about the truth if it's really difficult. So tell me what to choose if it's really difficult. I wanna choose the best if it's really difficult. Yeah. As I mentioned earlier, meron tayong strategies on how to answer difficult questions. Most especially sa mga SATA questions, bakit ganun? Halos lahat sila tama. Or meron din naman time na bakit ganun? Parang lahat sila mali. Mapapaisip ko talaga, saan ba lang galing tong tanong na to? Ang dami ko na-review, pero parang lahat ng tanong dito ay wala sa ni-review ko. Hi guys, welcome back to my channel, and today I'm going to share with you my tips on how to pass the NCLEX exam for the USRN. So without any further ado, just sit back and relax, and welcome to my channel. Alright, huwag na natin patagalin pa, and let's start with the tips. As I mentioned earlier, meron tayong strategies on how to answer difficult questions. Most especially sa mga SATA questions, may mga time talaga na bakit ganun, halos lahat sila tama. Or meron din naman time na bakit ganun, parang lahat sila mali. So ang ginawa ko doon, one of my strategy is prioritization. Kung ABC, papasok pa rin ng ABC dyan, airway, breathing, circulation, you know that airway is always the priority. Mga time kasi talaga na i-assess ng NCLEX yung talagang safe ka bang nurse. So, ang sa akin lang is kung ano yung pinaka-safe, yun ang iyong piliin. So, that's one of my strategies kung paano atakin yung mga difficult questions. So, prioritization, and then kung ano yung pinaka-safe. Since NCLEX is a safety exam. Prioritization, guys, of course, may mga makikita kayo dyan na kung sino yung mga unahin nyo, ganyan. So, kung aside from the airway, breathing, circulation, about the safety, alalahanin nyo rin kung ano yung mga patients nyo, kung pedia or geria. So, lagi ang priority daw is pedia. So, yun lang naman yung, of course, depende rin naman sa sitwasyon, no? But what I'm saying is that mas vulnerable kasi ang mga pedia as kung compared mo sa mga adults. Alright, so we've mentioned about the prioritization and also the safety. The third one is you have to know if it's stable or unstable. Of course, kailangan natin piliin kung ano yung unstable. So, paano mo malalaman kung ano yung mga unstable? Number one, it says about if it is acute or emergent. Most especially if the patients already arrive at the ER. So, sila yung mga priority. So, ito yung mga patients na agad-agad ay nagkaroon ng acute symptoms which are very abnormal, unexpected, and as we've said, the onset is very yung agad-agad, which is acute. So, mas piliin mo yon versus sa mga stable patients like yung mga may chronic illnesses, yung mga matatagal na. And then, if the vital signs are normal naman, so technically you don't select or not prioritize them. Next is also if it is expected naman with the disease, or if you are expecting the symptoms mag-arise doon sa certain disease na yon, you don't need to prioritize them. But of course, you need to take care of them. It's just that when you're answering questions, if you see some options that says acute, unexpected findings, went to the ER for admission, and if it's unstable. So one example, if you are prioritizing between the acute and chronic, what if on the question says there is rapid onset of pain, abdominal pain on the right lower quadrant of the patient versus an abdominal pain on the left upper quadrant which is tolerated by the patient for 8 hours. So, sino yung mas pipiliin pa doon? Of course, yung patient na nagkaroon ng rapid onset ng abdominal pain on the right lower quadrant, it might be an acute appendicitis. So, of course, it is more dangerous if it is already ruptured. You already know the strategies on how to prioritize, you choose safety always. We know what is stable versus unstable. So next is we follow the nursing process. Of course, as we all know, we have the ADPI, assessment, diagnosis, planning, implementation, and evaluation. So when it says the first thing to do, follow the nursing process. So ano ba ang nauunang process natin for the ADPI? Of course, it's assessment. So always assess the patient. What if wala sa option yung assess, but it was already mentioned in the question that you already assessed the patient with that symptom and then the progress of the symptoms. So what is the next thing to do? So the second step is to notify the physician about the assessment that you observed. So once you're done with notification, that's the only time that you have to carry out the doctor's order, and then you can give the medications or whatever procedure is needed and evaluate what is the response of the patient. From the time that you arrive, you assess the patient with the pain scale of 10/10 on the right lower abdomen, suggesting of diagnosis an appendicitis. And for that, we need to have an order from the doctor suggesting an impending ruptured appendicitis to plan what are the care. So by carrying it out, provide pain medications and continuous monitoring. And then evaluation is it is already improved, does it got worse, or is it needed to have a surgery? And a bonus tip pala, if you are familiar with the delegation, so lumalabas din sa NCLEX yan. So in the Philippines, we don't have the LPN, we don't have the CNAs. If you are working in the US, may mga certain procedures na pwede naman nating i-delegate sa mga CNA or sa mga LPN. So you have to be mindful of that. Alright, so you know the strategies already on how to answer difficult questions in NCLEX. We have the prioritization, choosing safety, determining if it's stable or unstable, and then the nursing process. Still, you don't know how to answer the question. I mean, sobrang hirap ng question and there's no one else to do but to guess. So the last resort would be the guessing strategy. Think of some keywords. You have to connect the dots. So that's what I do, most especially if it's, kumbaga, hindi ka familiar sa gamot na to. Ano ba tong gamot na to? Saan ba to nakuha? I mean, para saan ba to? Hindi ko naman to na-review, but there are instances that there are questions na masusubok talaga yung knowledge mo, no? Thank you so much for watching, and I hope I was able to help you prepare for the NCLEX-RN exam. And I wish you all the best and believe in yourself that you will pass the NCLEX. For any questions, comments, and suggestions, you can just comment down below and just hit subscribe. And without any further ado, thank you and see you on my next vlog.